And the renal disorders comes with a spectrum of problems. It includes hypomagnesemia, then comes acute kidney injury, and as I shown in the example, there is acute interstitial nephritis. If the prolonged intake is continued, that may result into chronicity and end-stage renal disease. That may cause or increase all-cause mortality, including death due to advanced renal disease. What are the cause? What is the data on that? So you can see first of all, we should see what can be the cause of that. And as we see, proton pump inhibitors can cause chronic renal failure by two pathways. One is it causes recurrent acute interstitial nephritis leading to chronic interstitial nephritis and end-stage renal disease. But there is another pathway where it can cause directly end-stage renal disease from the hypomagnesemia pathway. And you can see the hypomagnesemia is very common. In fact, FDA has shown that it has given a warning that magnesium level should be tested at least once in a year, because the association between hypomagnesemia and the use of PPI is very, very common. Moreover, we are now seeing the cause and effect, direct effect of PPI leading to either acute kidney injury or chronic kidney injury. This was the first case in 1992 when interstitial nephritis was attributed to the proton pump inhibitor, when the patient presented with renal failure and there was a eosinophil in the urinary sediments, and the kidney biopsy has shown acute interstitial nephritis. Since then, there is plethora of the data coming up showing the cause of this renal failure. And this is one of the very, very important study which is published in 2021, where this study had an objective of to detect the signal in very high population. 50 lakh adverse events were totally reported by this FAERS, that is FDA Adverse Event Reporting System. In this system, 50 lakh adverse events were reported of all the drugs. And out of them, there is a combination leading to around 3,000 adverse events were because of PPI and the renal failure. And this is how if you see the second bar there is missing indication of using PPI. So the bottom line is there is a data on showing that inadvertent or there is a very, very over-the-counter use of PPI leading to increased acute as well as chronic renal failure. And the adverse events start from the first year itself, but it accumulates over the 10 years. You can see on the left side the graph which has shown very high cumulative incidences of acute as well as chronic renal failure. So high proportion of renal injury occurred after the first year of PPI treatment, and the median time was high of CKD as compared to acute renal injury. And the odds ratio for chronic kidney disease is much higher than the acute renal failure. So the strength of CKD was stronger for AKI. So this has clearly shown that if the patient is continuing to take PPI, within 28 to 30 days there can be an AKI. But if the patient continues to take PPI for more than a year, there can be an element of chronic liver disease. And there are so many studies which are coming up, not only for acute kidney injury, but also for chronic kidney injury. For acute kidney injury, this is one of the very important trials which has clearly shown that there is a 2.5 times increased risk of development of AKI. And on the left side, the Benjamin Laris trial, which was published in JAMA, which has shown two cohorts. The first cohort was based on 10,000 patients, and that has shown that the baseline use of PPI was independently associated with 20 to 50% higher risk of CKD after adjusting to the potential confounding